I didn't start out as a nutritionist. I started out as a human geneticist, and I was interested in inborn errors of metabolism. So my initial education and then postdoctoral training was in human genetics. And I spent maybe 20 years after that at the Children's Hospital of Philadelphia, where I studied inborn errors of lipid metabolism. That was before I came to the NIH, and I've been at the NIH since '93. It's interesting to, everybody has a story to tell. And my story is that I was a long-time bench scientist at Children's in Philadelphia. And then there was a transition, and it was a fairly simple one. Funding started to become very, very challenging. And so I took the opportunity to come to the NIH, initially on a sabbatical, just because I wanted to find out what it was like on the other side. You know the difference between academic science and the government agencies that fund them. The problem is that if you're a funded scientist out in the field, you don't know anything about how the government really works. So I figured I'd take this opportunity. It was a good period in my career to do something like this, to come to the NIH, learn what it was like from the government side, and then I expected to go back to an academic position. And sure enough, 21 years later, I'm still here. So that was a major transition for me, but it turned out to be quite a terrific opportunity. So that involves even more transitions. I came to the NIH initially to run diabetes programs in the National Institute of Diabetes and Digestive and Kidney Diseases. So I was a program administrator for 3 years. And the opportunity came up to join the Division of Nutrition Research Coordination as its deputy director in about '96. And I took that opportunity. That was really my first full-time, honest, straight-up exposure to nutrition, although arguably my academic and research career beforehand prepared me for a nutrition kind of environment. And so that was one transition. That's how I got to nutrition in the first place. But the other thing that happened was that I stopped really being focused on research and then became much more focused on the translation of research into policy. And there began my interest in nutrition policy in the United States. I became involved in dietary reference intakes activities, dietary guidelines activities, and that led to my being one of the co-organizers of the National Nutrition Summit in 2000 here in Washington. As I alluded to in my earlier remarks, this is not a position for which I felt I had uniquely trained myself. A lab geneticist, and then suddenly becoming the director of the Office of Dietary Supplements. I think it was the lab training, the fact that I have an understanding of how science works, and maybe at least as importantly, I don't have a dog in the race. You probably know that the field of dietary supplements is pretty charged. Everybody has an opinion about dietary supplements, and those opinions range very, very broadly. Well, having somebody as the director of the science office that has the most influence over dietary supplement research, it's probably just as well to have somebody who doesn't represent a particular point of view, whether it's very, very positive advocacy kind of position or a very, very skeptical negative position. Keep an open mind about it and allow people to be able to have their say and to help me to decide where what the directions are. It was an opportunity that, while I had not necessarily prepared myself for, it's an opportunity that turned out to be enormously gratifying. I'm Canadian, so my early education and PhD training were in Canada. I did postdoctoral training in England. That was a transition. probably the biggest sort of personal transition was moving to the United States in the first place, and that was in 1974. Obviously, I've enjoyed it and thrived because I and my family have been here ever since. But that was a personal transition that needed to be made. Academic transitions, well, that's part of the game. I think in my case, the unique thing is that I had a long career in academic science before I came to the government. So I've spent just about as much time in the government as I did in academia. But that was a big transition. I would say that moving into nutrition, eventually, I finally saw the light, is probably what happened, and moved to nutrition, and that was certainly a transition for me. Dietary supplements, in my view, are a subset of nutrition, but what in the career of a card-carrying geneticist would have prepared them for a career as the director of the Office of Dietary Supplements? Not a lot, but it's been a fascinating learning experience all along the way. This is a unique opportunity, being the director of an organization like this. We have the chance to be able to influence not just research, but also to use the opportunity to translate that research into policy. So in my position as director of this office, I've been very, very fortunate to have exceptional people working with me and to have a budget that grew quite nicely for a while. I must say it's now been very flat for a while, but I'm not complaining about that. But I had the opportunity to grow things. And in this field, there were considerable opportunities for influencing research. In a nutshell, the needs were great, and I could help to fill some of the gaps in knowledge about dietary supplements. And of course, it's the ingredients in dietary supplements, micronutrients, bioactive components that are derived from foods, and herbs and so on. We share a lot with the food-oriented people and with the herb-oriented people, all of whom are represented in this field of dietary supplements. So how do we do our work? A major part of it is by working with others at the NIH to fund grants in this field. So about half of our budget is spent on co-funding grants in the field of dietary supplements with others at the NIH. And that accounts for about 100 grants a year for us. It's a relatively small investment, but in a field like this, it's very important to have that kind of investment, the federal investment in research. The other thing that we do that I think has helped the field a lot is that we've developed resources that can be used by a broad array of people in the field, from academic scientists to industry people to other government agencies, including the regulatory agencies, in order to do their work. And simply put, we've developed a program called Analytical Methods and Reference Materials, the goal of which is to help provide tools for analytical scientists in all of those settings that I mentioned earlier. And to provide tools that at the end of the day will help consumers feel much more confident that the products that they have in the marketplace are of high quality and contain what they say they contain. So that's one. Another is we've provided databases that can be used by scientists and others in our stakeholder community to conduct their work. Databases of dietary supplement labels and of dietary supplement ingredients. We also provide access to research findings in dietary supplements through a database that we call CARDS. Other things that we do that we think can help the community more broadly is that we work very closely with the National Health and Nutrition Examination Survey. We support the measurement of biomarkers of nutrition status, and we also support the collection of data about nutrient intake from foods and dietary supplements. And those together help a broader community of people because these, we can fund them and it makes them available for others to use. And I guess the last tool that we provide for people in the field of nutrition science is opportunities for training and for education. And then finally, all of this is intended to inform a very needy consumer public. A lot of dietary supplements are available in the US marketplace. And a lot of information is available about them too, all over the place. How much of it is reliable is in the eye of the beholder. What we like to try to do is to provide reliable, straight up, authoritative kinds of information about dietary supplements and their ingredients for consumers to be able to use when they're making decisions about what they're going to do. So I was made a fellow of the American Society for Nutrition last year, and that was a huge honor. I was awarded the Conrad Elvehem Prize for Public Service Nutrition a few years ago, and that one was particularly touching because I think it's important to recognize the value that nutrition science in the government, the value that it has for the broader community. So I took this as a recognition on behalf of a lot of nutrition scientists in the government. I'm on the board of the American Society for Nutrition for a couple of years, and I think that's a terrific opportunity to be able to see things in action, but also to try to shape future activities in nutrition. So I'm quite proud of those, and I think they're lots of fun too. This is a big question, and I've given it a lot of thought. From my perspective as a funder of nutrition science, I'm increasingly persuaded that we have to use interdisciplinary, collaborative approaches to solve the most vexing problems in nutrition. And part of the reason for that is that they're not unidimensional. So while I praise scientists in their laboratories everywhere, at the end of the day, I'm thinking that some of the next steps are going to have to be made by fostering collaboration among scientists, especially scientists of different stripes, different backgrounds, different experiences with different talents, to be able to bear on the broad topics that we confront with nutrition these days. Transition can be a big part of a career. And sometimes you don't know when that's going to happen. And all it takes is maybe just a little veering to the left, and suddenly you're facing a whole new array of opportunities. And then another little step to the left, and you're facing yet another array of possibilities. And I have learned, sometimes it's been a challenge, but I've learned that those kinds of transitions can provide real opportunities for you to be able to influence a field, as I hope I've done, but particularly to get satisfaction, and I know I've gotten that from being open to change and sometimes being a little afraid of it, but being open to the opportunities that it provides.